Hello, I'm Dr. Adriana Potter, and in our Benefit Yourself series today, we're going to talk about a series of activities that we do around the house that we don't realize that are aggravating your back or putting in a way of having some constant pain on your lower back. Okay, we all know that we do a lot of these things guilty here, so I'm going to show you a series of things that we do on a daily basis that if you start watching your body mechanics, you're going to be more successful in keeping a healthy back. Okay? Number one, doing the dishes. Alrighty. So many of us have dishwasher, and when we load the dishwasher, we find ourselves doing the following thing that is not good for you. Okay? We will open the dishwasher and we stoop forward. And this stooping in here, anytime we do this, it compresses your spine, and we want to try to avoid that. And the best way to do this is using your leg muscles to lower from your hips and knees, keep the back in a nice neutral position, keep the abdominals engaged, and then you can actually do the dishes. So that's number one. Now, loading the dishwasher is another one that is kind of pretty bad for you, and people don't realize that they do it very often, okay? Which is the following, right? You're gonna get your stuff to put inside the dishwasher, and a lot of us do a twist and a bending and put inside the dishwasher. And that's a no-no when you're having back pain. So you wanna make sure that you always position yourself to what you're gonna put it down. Okay, so if you're putting your dish in here, you're gonna turn around and lower from your hips and knees, and then turn around, get another one, and lower yourself, and keep this nice and neutral position. Same thing here, keep it nice and neutral. Scoop the dishwasher. You can use the hand here for support, and lift it up, okay? So dishwasher loading, unloading, and opening are very important for you to keep this nice and neutral position for the spine, okay? Another one that we do very often in the kitchen area is reaching underneath the cabinets, right? So let's say I need to go get something underneath. A lot of us do this. We open up, and I'm a little bit twisted, right? I'm doing something here. And I twist and bend over, and I grab my product from underneath of the cabinet or put it something underneath. Well, when you do this once or twice is not a problem, but when you do this very, very often, or when you have a back that is already not good to begin with, you want to avoid that. You want to make sure that you open the cabinet, position yourself towards what you're going to be retrieving, lower yourself on your hands and knees, and if you need support from the cabinet, and you can do a little kneeling down, retrieve what you need to retrieve, and stand up with a nice and neutral back. Okay? So that is the most common thing that people do very often in the kitchen area that you want to avoid. The laundry is another area that you want to be paying attention to what you're doing in it, because a lot of us do laundry quite often, and unloading and loading your washer is something very important. I have a bunch of laundry for me to do today, so I'm going to be doing this motion the right way very, very often. So my dryer just got ready. The most important thing to do, okay, a lot of us instead position ourselves in front of the washer or the dryer. We will be doing this sideways in here, and then we're going to open up, and we want to do this twisting, right? That's a no-no. That's the same thing we talked about it. If you're twisting and bending, you get more compression, and it's the classical mechanical pressures that he has in the spine that can create a herniated or a bulging disc. So you want to avoid that as much as possible. The right way to do it, okay, again, bending from your hands and knees, position yourself in front of your washer and dryer, have a basket ready, and then squat down and retrieve your load, okay? And a lot of people have those top loaders. They will do this. They will pick it up their load. They will lift, twist, loading the arm, and throw that. Again, that twisting and bending, that is a no-no. So if you are picking up your front load, top load, lift, Go in front of your dryer, squat it down, and scoop. Or put everything inside of the basket, squat it down, and scoop inside of the washer and your dryer, okay? So pay attention to that bending, twisting, and loading your arms with that bending and twisting, because a lot of the activities that we do around the house has that positioning that you want to avoid. So you always want to position your load in front of you and retrieve, right? There is a dirty clothes or your clean clothes from your dryer, and use your big muscles. A lot of my patients tell me, oh, it's so hard to lower myself down. I feel like I'm not strong enough. Well, that's one more reason for you to start doing it and doing more often, because you're gonna lose strength if you don't start using your muscles, right? So when you lost the strength and you are already weak, you will keep repeating it and eventually it's gonna get easier, okay? An alternative to squatting, right, it is actually kneeling down, and you can put a pillow, you can kneel down, and then you can actually maintain that neutral and the half kneeling, and you can load your washer, your dryer with a better mechanics, okay? So that's another one. Another common thing that we do, and you have to make your bed every day. You don't have to, but you should, because it gives you a nice sense of organization. But when you're making your bed and you tuck it in your linens, okay, you want to again maintain that nice tall body posture with a neutral spine. So whenever you tuck it in, many of us will do this, right? A little twisting, a little bending it, and you kind of try to do this, lift the mattress with one hand and tuck it in. Like I said, once or twice that won't matter, but over time that keeps filling up that cup, and your body can take a lot of abuse. But if you want to avoid it and maintain a healthy back, or make sure you're not aggravating what you already have there, because your back is already not good to begin with, you want to start changing your body mechanics around the house. So one more time, you're going to squat from your knees, right? Abs engaged, back in neutral, and you're going to lift your mattress. And if you need, kneel down, lift the mattress, and tuck your linens down and under, and then get up. So try to pay attention to that twisting and bending and avoid it. You see the trend in here? Twisting and bending to do things around the house. That's a no-no. All right, the other thing that I recently became a big issue for one of my patients is what she called a sock injury, okay? And then she said, I was just putting my sock on, and then after that my back was really, really bad. We're talking about not being able to walk, not being able to stand, difficulty with sleeping or rolling on the bed. It was really, 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 really bad. It took about 2.5 months to kind of recover from it. And the physical therapy in the beginning did not help for her. But little by little, things kind of calmed down as she started watching her body mechanics to not aggravate it. But it took a long time and a lot of rest, a lot of icing, a lot of medication, because just trying to stretch was aggravating. So pay attention to this. Many of us will do this. We will kind of reach out from our toe and try to put your shoes like this. So this is not bad in general, but if your back is already having some stenosis, you're already having a herniated disc, you want to avoid that, okay? So maintaining good rotation, good flexibility in your hips will allow you to put your shoes and not having that issue with a sock injury. And then you want to avoid this bending over and kind of putting your socks like this. Sometimes there's a lot of mechanical pressure that will aggravate, and your muscles will spasm, and it can dearrange the spine. So avoid that at all times, and try to maintain good rotation, stretching your muscles. This is actually a stretching position, and then you can put your shoes on and off with a nice, good, tall spine without compressing anything and creating the sock injury, okay? So pay attention for that, because this is a relative bending and twisting, okay? So you don't want to do that, okay? And the last one that we're gonna go over in terms of body mechanics is mostly for the moms and dads with little ones. So very often your kid's gonna be out and about and playing and doing something, and you might be doing something either in the office or on your table, and you actually wanna be able to kind of take care of your kids. So they call, mommy, mommy, pick me up, or they come and they just, oh, come here. So I don't have little ones anymore, so I'm gonna demonstrate with my awesome pillowcase in here. But we'll do this, right? So we have this little one, we're twisting, and then we come here to reach that baby a little bit lower, grab the baby. So now we're adding a load. We are not only twisting and bending sideways, but we're adding a load to that baby, and we're gonna pick it up, that baby, and put it in our lap like this. Well, again, we twisted and bended and added a load. What I think is gonna happen over time, you're just creating a pretty bad scenario for your back to not give up on you, okay? So pay attention. Again, you're gonna pick up your little one, turn your legs towards that little one, and then come here with mommy, facing forward, grab it closer, or make them climb if they are able to. Climb up, come on, make it fun, right? But pick them up, and then go ahead and sit, and continue what you wanna continue on that table. But avoid that bending and twisting. We don't pay attention to those things, but then later on, maybe not at the time that you're actually doing the activity that you're gonna hurt, maybe the next day or the next couple days, and you may not recall, well, what did I do, right? I just, we never cross your mind about picking up your kid will cause that problem, okay? So make sure to always face towards the task, whether it is picking up your kid, whether it's putting the dishes in the dishwasher, loading the washer and dryer, doing your bed. You want to make sure you're always facing your activity. That way you maintain your body nice and tall, and you maintain the spine in a neutral position. Alrighty, this is all for the body mechanics tips for you to help your back to be strong and healthy or prevent aggravations in your lower back. My name is Dr. Adriana Potter, and I hope you enjoy your video on the benefit yourself on the body mechanics. Don't forget to subscribe and press the bell button for future information.